আজকে আমরা কথা বলবো নিউরাল সায়েন্স কি। সাইকিয়াট্রির একটা পার্ট হলো নিউরাল সায়েন্স, অর্থাৎ সাইকিয়াট্রিস্ট যারা যারা মানসিক চিকিৎসক, মনোরোগ চিকিৎসক, তারা নর্মালি এ পর্যন্ত মানুষের যে মানসিক বিভিন্ন রোগ, সেই রোগগুলোকে তারা সবসময় সিনড্রোম বা উপলক্ষণ দেখেই শনাক্ত করার চেষ্টা করে। বাট আজকে আমরা নিউরাল সায়েন্স নিয়ে কথা বলবো যে আসলে মানুষের বিভিন্ন রকমের মানসিক রোগ নির্ণয়ের ক্ষেত্রেও মানুষের মস্তিষ্ক কী পরিমাণ ভূমিকা পালন করে সেটা আমরা পড়ে পড়ে শোনার চেষ্টা করব আর কি। আশা রাখি সবাইরে ভালো লাগবে। নিউরাল সায়েন্স ইন্ট্রোডাকশন। The human brain is responsible for our cognitive processes, emotions, and behaviors. That is, everything we do, everything we feel, everything we think. Although the early development and adult function of the brain are shaped by multiple factors, as for example, epigenetic, environmental, and psychosocial experiences, the brain is the final integrator of these influences. Despite the many advances in neural sciences over the last several decades, including the decade of the brain in the 1990s and the wide acceptance of the brain as the biological substrate for normal and abnormal mental functions, there has not been a true transformational advance in the treatment of mental disorders for more than half a century. The most obvious reason for the absence of more progress is the profound complexity of the human brain. A perhaps less obvious reason is the current practice of psychiatric diagnosis, which for most clinicians is based on syndrome based classification systems. The purpose of this chapter The purpose of this chapter is to introduce the neural sciences sections, which describe the anatomy and function of the human brain, and then to discuss how an evolution of thinking toward a brain based or biologically based diagnostic system for mental illness might facilitate our efforts to advance brain research, to develop better treatments, and to improve patient care. In other fields of medicine, diagnosis is based on physical signs and symptoms, a medical history, and results of laboratory and radiological tests. In psychiatry, a diagnosis is based primarily on the clinician's impression of the patient's interpretation of his or her thoughts and feelings. The patient's symptoms are then cross referenced to a diagnostic or classification manual, as for example, Diagnostic and Statistical Manual of Mental Disorders DSM 5, International Statistical Classification of Diseases and Related Health Problems ICD, containing hundreds of potential syndromes, and one or more diagnoses are applied to the particular patient. These standard classification systems represent significant improvements in reliability over previous diagnostic systems, but there is little reason to believe that these diagnostic categories are valid in the sense that they represent no symptoms or complaints can be diagnosed. uh, they represent discrete, biologically distinct entities. Although a patient with no symptoms or no complaints can be diagnosed as having diabetes, cancer, or hypertension on the basis of blood tests, X-rays, or vital signs. A patient with no symptoms cannot be diagnosed with schizophrenia or schizophrenia. A patient with, for example, because there are no currently recognized objective independent assessments. The goals of clinicians and researchers are to reduce human suffering by increasing our understanding of diseases, developing new treatments to prevent or to cure diseases, and caring for patients in an optimal manner. If the brain is the organ of focus for mental illnesses, then it may be time to be more ambitious in building the classification of patients with mental illnesses directly from our understanding of biology rather than only from the assessment of a patient's symptoms. So, the human brain will play a vital role one day in diagnosing physical, biological diseases as well as the psychological maladies or psychological diseases. So, we can hope that there will be a time when psychiatrist will diagnose the patients based on a blood test, based on x-rays or vital signs. They will diagnose patients for their psychiatric disorders. So we can hope this tomorrow there will be a very good time when psychiatric disorders will be biologically determined by the psychiatrist. So thank you very much. And this channel is all about education purpose. And if you think this channel of education and knowledge entertains you, gives you pleasure, you can subscribe and share this video, and you can make your comments. So thank you for watching this video. Bye bye.